Greetings, my fellow beings. My name is Amanda, and today we are going to be watching another mystery diagnosis, and this one is on Ehlers Danlos syndrome. So I'm going to be reacting to whatever is in this episode. I have not seen it yet. I swear I have seen all of these episodes, but it's been a really long time. So we're going to watch it together and see if any of them match what I'm going through. Because I know that this is pretty accurate because they're going from the point of view of the person that is in the middle of the illness, but we'll just see if any of it goes with what I'm going through and talk about it, and that's what we're going to do. So let's get started into watching this video. Oh, I'm going to be taking the rest of the month off because it's been a little bit hectic, which you noticed that I didn't post last week. It's been a little bit crazy, so I'm just going to take the rest of the month off, which is only like a week. I think it's only like a week, maybe 2 weeks. So don't panic if you don't see me. Not that there's many out there that would panic if I wasn't on YouTube, but just so you know, I'm going to be taking the rest of the month off. So let's get into this video.
In the spring of 1974, 15-year-old Lynn Sanders had a reputation as one of the best swimmers in the small Wisconsin town she grew up in.
I medaled in the Parkland Conference when you swim against all other high schools, and I took third place in breaststroke, which I was really proud of.
But one afternoon, as she's gliding through the water, Lynn starts to feel something she's never felt before: agonizing pain in her hands.
It was really uncomfortable, achy, like I had the flu or something.
Lynn describes the strange soreness to her mother, who insists on taking her in to see the family doctor. He immediately assumes that the teen has broken a small bone in her hand from the strenuous water workouts. But after taking an x-ray, nothing appears out of the ordinary. The doctor chalks her aches up to growing pains and encourages Lynn to keep her hand wrapped in a support bandage whenever the pain flares up.
Kids are...
Okay, so this right here, yeah. So as an adult, looking back on my illness, I can see things that I didn't know when I was younger. But after being diagnosed with Ehlers Danlos syndrome and being able to look back at my childhood, everything seems to click into place. Everything seems to make sense now. And the whole growing pains thing, yeah, I was always told that every ache and pain that I had was growing pains, when in reality it was Ehlers Danlos. So my hands hurt all the time. They crack a lot. And I was super bendy, flexible, could never figure out why. I used to gross my friends out by all the things that I used to do with my body, with my hands particularly, because I could bend them in weird shapes and whatnot. But everything seemed to ache and everything seemed to hurt, and it was mostly my joints, and it really hurt. And so they kept telling me, well, you must have arthritis. And I'm like, I am like 8 years old. What? So it didn't really make sense to me. Though it is possible for children to get arthritis. I don't want anybody to think you can't. But it was kind of weird for me to think that. So this, oh, growing pains, yeah,
Always asking you, why are you wearing that? So you have to explain a story that I just sprained myself. I didn't want to let them know that the doctor just said it was growing pains.
Worse still, as the weeks drag on, the pain in her wrists does not get any better. In fact, they eventually become so tender that she can no longer keep up with the grueling swimming workouts.
Basically, the pain forced me to quit. It was very difficult to quit the swim team, and my parents were disappointed.
Despite the strange looks she keeps getting from classmates, Lynn does her best to just live her life like a normal teenager. She starts going to the local roller rink after school, hoping to make new friends.
It was boys' choice, and I asked her to skate, and we ended up going on another date from that.
During the dating years, I would mention every once in a while that my hand or shoulders were hurting, but I didn't really want to keep mentioning to Dave about all my pain because I didn't want to chase him away.
By the time her senior year rolls around, Lynn is living with chronic pain 24/7. While Dave is essentially unaware of what she's going through, he does notice that Lynn has a propensity to hurt herself.
He would call me klutzy. He would see me do klutzy things.
But nobody realizes just how bad her situation has become.
I will say with the klutzy thing, that was always an attribute of mine, was she's such a klutz. And I would run into things a lot, and I would trip and fall a lot, and they always just thought I was clumsy. But now I understand where that's coming from, and that makes more sense. But yes, I was always called clumsy or a klutz. Always.
In fact, Lynn's hands have gotten so sore, she's starting to have trouble performing even the simplest of tasks.
I really did feel alone. My mom would tell me to just wrap it up with a bandage and, it'll be better in a couple weeks.
Weeks, then months go by, and the relentless pain doesn't let up, despite the fact that she's wearing the hand braces and taking aspirin 4 times a day. Then, right before graduation, Lynn notices something very unnatural while she's going through her morning stretches.
My elbows looked different. They rotated weird.
I was not aware that Lynn had hypermobility of her joints. It wasn't something that she shared with me or really anyone.
But soon after the young couple gets married in 1978, Lynn can't hide her condition from Dave any longer.
So yeah, so when I say that I would do weird things with my body, that bending it backwards, I can't really do it very much because it really hurts. But when I was younger, I used to bend all over the place and get my fingers in weird positions and freak my friends out all the time because it was weird. And yeah, it always looks weird when I flex my joints because they're hypermobile, so it does weird things. And so I understand this, and the things that they were doing, I'm like, hey, that's me.
It becomes clear that the genetic counselor is far more worried about Lynn than her daughter.
Luann asked me, every time I see you, you're in a different cast.
So started asking her a lot more questions about her health history. I felt it was important that I make her aware of a condition that might explain her problems.
Lynn can't believe what Luann is suggesting. She spent nearly 15 years hearing that she's just different. But secretly, she's always suspected there was more going on.
I was totally desperate for some kind of answer to all the aches and pain that I had since I was 15 years old.
Luann advises Lynn to get in touch with a genetic specialist immediately. She tracks down Dr. Pamela Trepane and hands over her extensive medical file. Dr. Trepane begins conducting her own investigation.
That reminds me, when I was growing up, my medical records were always super thick, and I had multiple of them. And in the military, it just went from base to base, and it just kept getting bigger and bigger. And then we'd have to ask for medical files to be transferred to the next base. And then when I finally when we finally were leaving the military, asking for my medical files was like pulling teeth. But I had huge medical files. Because of how many times I was in the hospital, and it was just awful. And we used to have a running joke about how fat my medical records were. So I feel this. I know this.
By having Lynn perform very specific tests on her joints.
There is a scale that we use to be able to assess joint instability and joint hypermobility.
In other words, how mobile are her joints? Looking at her skin, how stretchy it is.
Based on that type of a physical exam, in addition to her medical history, makes that diagnosis. Lynn has classic features of Ehlers Danlos syndrome.
Yeah, so the stretchy skin thing, growing up, my sister used to always pull on my skin, and she's like, you're so stretchy. And it was just a fun thing that she would come up to me and be like, look how stretchy your skin is, and never knew why. And it's always velvety soft as well, and couldn't figure out why. And now it all makes sense, now that we know what it is. And so pain in the joints, being hyperflexible, having very stretchy skin, velvety soft skin. It all makes sense. And I was able to find a doctor that he himself has Ehlers Danlos, and he performed the tests on me and diagnosed me with Ehlers Danlos as well.
Ehlers Danlos syndrome is a disorder in which a genetic mutation disrupts the patient's production of collagen, a type of protein that acts as a glue and holds our skin, muscle, and ligaments together. Without the adequate collagen, Lynn's body quite literally began falling apart.
Lynn's joint pain is a direct result of the poor collagen and the poor elasticity. Many children, their parents will describe them as being clumsy, when in fact they're trying very hard to keep their whole body in appropriate alignment.
You think back and think, well, maybe she wasn't the klutz that we thought she was. It was related to this condition that she had no control over.
Dr. Trepane speculates that Lynn's pain progressed slowly from her hands and wrists to other body parts because the joints that are used most often feel the wear and tear first.
When Lynn was pregnant, she felt even more fatigued. We're already talking about joints that are unstable, and now you're adding the load of the pregnancy on top of that and a shifting center of gravity. All of those things then will combine to create increased joint pain. Historically, people who had classic Ehlers-Danlos syndrome had incredibly stretchy skin. Within circus environments, you see the people that can stretch their skin, taking their earlobes and pulling them down.
One of the big puzzles, of course, for Lynn was why it took so long for people to make this diagnosis.
She did not have overly stretchy skin. Unfortunately, what most physicians have learned is that's EDS.
While it's reassuring to finally know what she's been living with all these years, Lynn is not prepared for what the doctor has to say next.
There is no cure for EDS. We cannot go in and fix the gene that is making the collagen incorrectly. We can, however, provide good pain control and good physical therapy.
Lynn begins a rigorous course to strengthen and steady her joints and takes prescription medications to help manage her pain. Unfortunately, she will continue to require surgeries to tighten up her ligaments as they wear out.
I'm trying to go and do the best I can each and every day. Every day is a new day.
To date, Lynn has had more than 40 surgeries. She also wears custom-made silver ring splints to help stabilize the joints in her fingers.
I wear these just to prevent tearing in my ligaments in my fingers, and also it really does help with pain.
I've actually looked into getting custom things like that for my hands because my hands hurt all the time, and so that's something that I've actually looked into. And it was my sister who actually found them originally and sent me a link, and she's like, oh my gosh, I think these would work for you. And I was like, oh my gosh. So I have actually looked into getting braces like that, the custom made. They look like rings. So I've thought about that as well.
Lynn is still coming to terms with the fact that her disease will never go away. But she finds her inspiration to face each day through her husband's unwavering support.
It takes a special person to marry somebody and still stand by my side. 33 years since we met.
It's for better or worse in sickness and health, and that's pretty much what I stood by.
Today, Dave and Lynn remain hopeful for a cure. In the meantime, she's doing all that she can to help patients like herself. In 2006, she started the Ehlers Danlos Syndrome Network Cares.
You have to be your own advocate. I hope someday every doctor knows something about Ehlers Danlos syndrome.
So that was a really good episode. The one problem that I have with this episode, and it's not really a problem, it's just what I don't understand, is the pregnancy aspect of it. And I understand why she would be feeling that way during pregnancy. Logically, I understand that, but I have never gone through it, so I can't attest to it. And it is something that I am slightly scared of, because I know that a lot of people that I've talked to that have Ehlers Danlos have had hard times during pregnancies. And so that is something that I have thought about and is something that, concerns me about having children. So that's the only part of this episode that I don't have any firsthand experience with because I've never gone through it. But the being called a klutz growing up, dropping things all the time, joints hurting constantly, having very stretchy skin, not as stretchy as being able to pull my earlobes all the way down, but enough that it was markedly different than other kids my own age. And being hyper flexible and being able to do all kinds of weird things with my hands and with different joints of my body, that I do understand. And looking back at it through my childhood, it all makes sense now. And other family members are now starting to realize that, you know what, I should probably get tested for this because they have extremely similar symptoms to me and they're related to me. So the likelihood of them having it, you know, there's a good chance. So they're going to get tested for it as well. And that would also make a lot of sense looking back at their lives as well, being like, oh, well, that would make sense if you had hypermobile Ehlers Danlos syndrome. That would make sense. So there's that. I really enjoyed this episode. It was very informative and tells a lot about what people go through in their personal lives and how hard it is to get a diagnosis in the long run because it's not a very common illness. So I'm not too surprised that it took her that long, and I'm 36 now, so it took me until I was 34, 35 to be diagnosed with Ehlers Danlos. So yeah, it takes a while, and I wish that more doctors understood it and they would be able to diagnose it quicker, because even though there's no cure for it, it would help you manage your life better if you understood what was happening to your body. So I hope you enjoyed that episode. I hope that you enjoyed learning more about Ehlers Danlos syndrome, and I hope that you enjoy your holiday season, and whether or not you celebrate any of the holidays that are going on right now, or you're just spending time with family and just enjoying a break, I'm glad for you. Enjoy it. Remember to take it easy. Remember you come first, and your health is a priority. So make sure that you take it easy during these times. I hope that you enjoyed this. If you did, click that subscribe button and go ahead and click that like button if you did enjoy it. Remember to be kind. Kindness is free, so give it out to everyone, and I'll see you next time. Bye.